Hi, Dr. Beyer again. Today we're talking about our wonderful thyroid function. We know that every cell in our body is dependent upon thyroid function, and what thyroid hormones do is they tell our nucleus, our DNA, our genes to make proteins, enzymes, which are proteins, new DNA to replace old cells, and structural proteins. It is our major metabolic hormone in our body, and there are many reasons why it can become low, and your doctor only looks at one of them. Okay, so there are multiple pieces to the thyroid dilemma. Today we're going to talk about your gallbladder. Now, how in the world can a faulty or a dysfunctional gallbladder cause low thyroid? Well, first of all, there's a lot of reasons why your gallbladder can become dysfunctional, and it's usually due to poor stomach acid production, poor pancreatic acid production, and the vagus nerve from the brainstem not working. But here's how the gallbladder can affect your thyroid function, and I see it a lot. You need your gallbladder. Your gallbladder stores bile from your liver, and it concentrates it, and you need bile to be able to absorb your fats and some very important vitamins, your fat-soluble vitamins, vitamin A, D, E, and K. Vitamin A is crucial that we absorb vitamin A because vitamin A allows our thyroid hormone to get into our cells. If you're making enough of the thyroid hormone and it's not getting into the cells, all bets are off. We need vitamin A for that. So a lot of our underactive thyroid patients are deficient in vitamin A. Also, vitamin D, which is a fat-soluble vitamin, which is dependent upon gallbladder function, is important for immune function. The number one cause of underactive thyroid is an autoimmune condition known as Hashimoto's. Some of you know you have it. Some of you probably have it and don't know it because it's very underdiagnosed. And when you have this immune dysfunction and the immune system's attacking your thyroid, you need lots of vitamin D. Somebody who is autoimmune, their vitamin D does not work a 40-hour work week. It works an 80-hour week. You need it for your regulatory T lymphocytes in your immune system. Also, bile, which is produced or stored in the gallbladder and it's concentrated, is needed to remove toxins. The thyroid and the parathyroid gland are very susceptible to toxins. Those cells will not work right. Those glands won't work right when we have toxic overload, and you need bile to get rid of. I call biles like Velcro when it comes to removing toxins. Folks, also, the way your body uses bile to get rid of your old hormones. The way hormones work is you make them, you use them, and then they gotta go. And we see a lot of women with estrogen dominant type conditions where they're not able to get rid of their estrogen properly, and that will affect hormone function. And they're not able to get rid of their estrogens because they're not producing enough bile and the gallbladder is not working. I'm Dr. Beyer. I hope that helps. Talk to you next week.